Today is Wednesday, August 21st, 2024. It is 9:25 p.m. and today was day 21 of transcranial magnetic stimulation therapy, or TMS, for depression and anxiety. Um, I don't know, today felt like a stressful day. Um, on my way to the TMS center, I already was getting a little bit of a headache because I didn't really eat well during lunch. And I should know better than to not like eat well, but it was a busy day. I had a day full of sessions and testing, so I didn't have much of a time to eat in between. Um, so by the time I got out of the TMS session, I had a huge headache, which felt more like a migraine. And then I got home and it felt like I was going to throw up. But I don't think that it was a side effect of the TMS because up to now I haven't been getting any migraines due to the TMS. I think it was because, again, I did not eat. I took like one or two bites of my sandwich, and then I ate some gummies or something. Um, but yeah, I feel like a lot of my problems that I have when I feel sick or when I have headaches or migraines are probably due to me not taking care of myself physically and really eating healthy throughout the day the way that I'm supposed to. Even my meal schedule's kind of all over the place. And then so I got home and I was so exhausted and I had a huge headache. So I ate and I went upstairs to my room and I took like a 1 hour nap. And then afterwards I felt a little better. So um, I don't know, I just felt more fatigued than what I had been feeling in the past. Um, what else? It was a more anxious, kind of stressful day because it was just my supervisor and I in the room, and she's a pretty nice person for the most part. But I feel weird when it's like awkward silence. And usually the slipper, who's the speech assistant, who is usually also with us in the room, uh, I don't know, is pretty good at breaking awkward silences because she and my supervisor get along really well because they've known each other for longer than my supervisor and I have like known each other. So since the assistant, was out sick today and might be out sick for the rest of the week, it was just my supervisor and I, which I don't know. It was kind of awkward. Then again, maybe it's just me. I'm the one who makes things awkward. Who knows? I feel like my supervisor and the speech assistant are both very like type A, like more social, outgoing individuals where I'm just the type of person who's a lot more introverted and I suck at socializing, and my crippling anxiety and depression doesn't help much. So again, it's that whole situation with having to share a space or a room with another person all day long really adds to my stress levels. Um, yeah, so I think yesterday, I mentioned that the psychiatrist said that he was going to change the protocol a little bit for the TMS, increased the tapping intensity on the right side to 125, which is supposed to like tone down my inhibitory responses, which I think is kind of what makes me more anxious. And I also told them I had been feeling more irritable. And I guess it makes sense because, uh, like, I know people say when you drink a lot, your inhibition kind of takes a tank, right? And that's what makes people do all kinds of dumb things because they're overly relaxed. They're really not thinking about like the consequences of things. And I think my inhibition or my inhibitory response is like too activated. So that kind of makes me more anxious. Um, but I wonder how tapping on it or sending those signals is supposed to like um, calm that response or calm those receptors or whatever, as opposed to just activating them. Because on the left side, for the depression, it is said that the tapping is supposed to activate those certain parts of the brain that um, are not as active during depression. So wouldn't it make sense that it tapping on the right side would activate the inhibitory responses even more? Um, but the psychiatrist said that um, I don't know. I'm just confusing myself now. I guess I should probably ask him about it when I talk to him again, or maybe I'll go online and do some research and see what I can find. Um, so yeah, so they got up to I think 115 on the left side with the fast tapping for depression. They didn't quite get to 125 on the right side because there are two different technicians that administer the treatment. Um, and one of them, for some reason, I don't know if like maybe she's newer or, but sometimes when she like sets up the system and the tapping starts, it really makes my hand twitch. And I think that's because something like it's misaligned because once I bring it up, she'll align the machine again and the tapping will stop. I mean the not the tapping, the twitching of overly twitching of my hand will stop. Like because I guess it's not supposed to be doing that. And because we had to do that and she had to realign the machine, we actually didn't get to the 125 on the right side like we were supposed to. But tomorrow I think it'll be the different technician who I feel has a little bit more experience. Um, and we might end up getting to 125 again on the right side, which is supposed to do something for my anxiety and irritability. Um, and still staying on at the one. I don't know if we've reached 120 yet for the left side, which is supposed to be for the depression. I think, I don't know. I think the max is 115, or I could be wrong. That we've gotten to it anyway, but we're supposed to get up to 120. Um, I don't know if we've gotten there yet. Correct me if we did, because we might have in the past, and then maybe I mentioned it in different videos. And if you're following along, I'm sure you know better than I do at this point, because like I'm just so exhausted. Um, I'm not experiencing like I am experiencing some moodiness, right? Like a little bit more irritable, more anxious, but I'm not experiencing as much brain fog as I usually do, which I think is a good thing. But yeah, I will be back tomorrow to report on day 22 of TMS treatment. Wait, anxiety and depression. Before I go, the ratings for today were when I went in, I rated my anxiety at a 7 and my depression at a 5. What I'm feeling right now, I don't think is depression. I think I'm just so exhausted. I feel a lot of like fatigue. Yeah, so now I'm going to end this video for real now. And I will see you guys tomorrow to report on day 22 of TMS.